Welcome back to the American College of Surgeons Bulletin Brief from the front line, Surgeons' Voices. It's with immense pleasure today that I introduce to you our soon-to-be newly elected officers of the RAS-ACS Society, starting with a return guest to our program, Dr. Yewande Alimi, who's at MedStar Georgetown University Hospital, and she will soon become the chair. She is now the chair-elect of the RAS. Dr. Julia Coleman from the University of Colorado, who's the vice-chair-elect of the RAS Executive Committee, and Dr. Kaitlin Ritter, also from Colorado, who's the RAS Executive Committee Secretary-elect. Welcome to the program.
Thanks for having us.
Great to have you here, and really excited that the three of you are going to be at the helm of the RAS starting at the end of the annual clinical congress in October. So I'd like to start out giving you a little bit of an opportunity to speak about the RAS. Not everybody may be aware of it, and particularly bear in mind that we have many international fellows and international viewers and listeners to this particular segment of our weekly bulletin brief. The biggest, in fact, number proportionally of our initiates, both numerically and proportionally, are in fact international. So give us a little talk, and maybe we can vary up the topics and start with Dr. Alimi. Just give us a little history. What does the RAS do? Who's in the RAS?
Thanks again for having us and having me back. So the Resident Associate Society is an arm of the American College of Surgeons that comprises residents and fellows, where fellows are fellows in their clinical practice and not fellows of the American College of Surgeons. We comprise the residents and fellows as well as the associates, so new to attending physicians who are not yet fellows of the American College of Surgeons. So this is a young cohort of physicians still in training for the most part, but also early in their practice. Through the RAS, there are many committees that residents and fellows can engage in and participate in the American College of Surgeons. And so a number of those committees are titled to include the Advocacy and Issues Committee, the Communications Committee, the Membership Committee, as well as the Education Committee. And through these committees, residents can be engaged in different projects that we bring out to our membership. I'll let Kaitlin and Julia talk a little bit about some of those specific committees that they've been highly part of, but the membership committee as well as the communication committee serve to get information out to young members of the American College of Surgeons who are RAS members. Everybody, by virtue of being in RAS and being a young member currently in training, is a member of RAS. And the way that people can get engaged is simply by joining a call once a week and each month. And joining those committee calls can get you sparked or interested in a certain topic that we're working on. And by that virtue, you then become engaged in the committee. So it's really easy. It's one phone call once a month, or you can try all committees and join one phone call 4 times in that month and figure out what suits you best. So I'll let Julia and Kaitlin talk a little bit about the Advocacy and Issues Committee and the Education Committee, and then we can talk more about RAS.
Great, that's fantastic. Dr. Coleman, we've spoken in the past, and I know how energetic and enthusiastic you are. So tell us about some of these great committees.
Sure, thank you again, Dr. Wexner, for the opportunity to have me on again to talk about advocacy, which is what I'll talk about today as well. So as Yewande mentioned, one of the committees is Advocacy and Issues Committee, which I've been happy to be a part of. And I really can't emphasize enough the importance of surgeon engagement. And the sooner that you do that, the better. If we are not engaged in policy and in advocacy and in conversations about healthcare changes and modeling, then decisions will be made for our patients and for us without any of our voice and our patient-oriented attitude. So surgeon advocacy really can't be overstated. And so the Advocacy and Issues Committee allows an avenue for people who are a little more junior to sort of get their feet wet and understand exactly what it takes navigating surgeon advocacy, which can be as simple as writing your Congress people and talking to them about issues that affect the American College of Surgeons and our patients, to being even more engaged and participating in the Leadership and Advocacy Summit, which happens every year in DC. Hopefully in person again soon, where we actually meet with politicians and we meet with policymakers and we talk about the issues that are affecting our patients. That has ranged from anything from firearm injury prevention, of which we've made a podcast talking about surgeon engagement and firearm injury prevention advocacy, to issues around educating medical students and residents and the framework in which we are currently allocating spots for trainees on a resident and a fellow level. So I highly encourage anyone to join. It's the first Wednesday of the month, and find out a way to get more engaged in surgeon advocacy for our patients and for us as a cohort of physicians.
Thanks, Dr. Coleman. Certainly your enthusiasm, your infectious enthusiasm, infectious in a good way, enthusiasm for advocacy has not dampened in the least since we last spoke. I'm glad to hear that, because we need all the help we can get as we come towards the end of another calendar year. Dr. Ritter, you've got two very dynamic people speaking up their aspects so far. Tell us about yours. What do you like best about RAS? Where's your engagement been? As well as what are some of your plans as Secretary-elect?
I think you put that very well, Dr. Wexner. Between Dr. Alimi and Dr. Coleman, I've got some really great role models and footsteps to follow as a new member of the executive committee this upcoming October. Prior to being on the executive committee, I was really involved in the education committee, which is a very kind of broad committee. It addresses surgical education from a variety of different aspects. Some of the big things that we do that I think people are probably most familiar with is every year we help write questions for the Jeopardy competition that happens every year at Clinical Congress. And we also put on the surgical skills competition, So You Think You Can Operate. And hopefully once Clinical Congress can be back in person, we'll be able to get those events up and running again. But the Research Education Committee also focuses on how surgical education is administered in the United States. And we look at the needs of our constituents and of the various residents across the country during the COVID-19 pandemic. When it first started up and a lot of resident didactics were canceled, the Education Committee created a national curriculum that we put on every week with experts from various fields coming and giving talks, and any resident could sign in. And it was a way to meet the need that residents had during that time. So we focus on projects like that, but we also are a resource for residents that are interested in surgical education who may not have the resources at their home institution, may not have, mentors who are interested in that. And we have a research group where people can come and join, and we work through the different aspects of how do you start a surgical education research project and how do you kind of get yourself started on that pathway. So I think the Education Committee really has a broad range of options for people that are interested in surgical education, whether it's in the actual teaching or the actual academic side or all of it. To your second question about kind of what I'm hoping for the secretary, Julia and Yewande, like I said, have really set some lofty goals, and I think really helping support the team and their overall objectives for this year. I know diversity, equity, and inclusion has been something we've been actively talking about and trying to make sure that our policies and our interventions really reflect and meet the needs of the entirety of the surgical community, not just ones that have been traditionally represented. It goes a little bit back to your conversation about how many new members of the American College are actually from international locations. And I think something that's great about RAS is you don't have to come to a meeting in person. We have these monthly phone calls so people can call in from all across the globe. I know on the Education Committee, we've got several members that are international medical graduates who are applying to come to the United States, and several who have kind of already gone through that process. And we've helped set up some mentorship for people that are interested in that. So I think it's really a wonderful organization that is open to anybody, because if you have a phone and time, you can call in and get involved.
That's wonderful. And it's easy to get involved at the beginning. It sounds like you're automatically involved by virtue of just being a resident. What is the upper end? At what point does one transition from RAS to YFA? I can think of several leaders during my years on the Board of Regents who used to be leaders of RAS and went on to YFA. What's the transition point? And is that automatic, or does one have to apply?
Once an associate member becomes a fellow of the American College of Surgeons, they transition out of the RAS into the YFA. And so YFA are fellows of the American College of Surgeons who have applied, gone through the interview process and that full application process, but are under the age of 40. And so when you make the transition from an associate member to a fellow in the American College of Surgeons, which is an application process and an interview process, and you are under the age of 40, you are automatically in YFA. And that's when folks transition out of the RAS cohort.
Great. So we've heard about advocacy, we've heard about education, and some of the telephone calls that go on. Dr. Coleman, I know you've probably got some ideas of some things you'd like to accomplish in the next year. Maybe you could tell us about them, whether the new programs or expanding current ones.
Thank you. So we have really enjoyed the opportunity to have a resident program at the Clinical Congress. And so a big part of what we do each year is planning a program that we think really best meets the needs and interests of our constituents. And so one thing that we have been able to keep consistent in the virtual era is our symposium, which is where we have a debate, a pro-con discussion about a hot topic in surgery. And this year we're going to be talking about competency-based training and what are the metrics that we should evaluate people and their performance and their training progression in surgical residency. So that's a topic for this year. Previous topics have included everything from the role of APPs in surgical education and training to the role of surgeons in advocacy. And so that is going to be the debate for this year that will continue on. And our hope is that in the future, we'll be able to return to our in-person programming there as well. And on the same token, we're still participating in the annual Leadership and Advocacy Summit, as well as the Quality and Safety Conference. And at both of those recently, we've approached the topic of DAI, and that's really something that we've been passionate about trying to pursue this year and moving forward. So hopefully we can continue some of those programs virtually and then in person when that becomes an opportunity as well.
Fantastic. Dr. Ritter, I'll give you the opportunity as the first of the three people to leave us with any parting words.
Oh, thank you. I think the biggest parting advice that I could offer to anyone watching, if you're interested and want to learn more, RAS has been a really spectacular organization. One of my colleagues brought me to the RAS governing meeting that happens every year at Clinical Congress. And I didn't really know what RAS was, but he was like, you like education, you should come to this. And I got involved kind of slowly and steadily through that process. I met a really spectacular group of individuals who are passionate about things that I'm passionate about. And it's kind of expanded outside of just, a committee that I'm on through the ACS to really a community that I'm involved in now. I have group chats and threads with people that are from different committees, and we talk back and forth and we celebrate each other's achievements and accomplishments, and we help support people. Someone's interested in doing a research project, so they see if my institution would be interested in helping out. And so it's a great resource for young surgeons to really network with people that can be passionate about the same things you are and to get involved at a national level.
Great. Dr. Coleman?
I would echo Kaitlin's comments about this really is a family that you'll find once you start getting engaged. When I had family that was in the hospital, when my son was born, the cards and calls that I were getting were from people that are a part of this organization. So I really welcome anyone to engage and participate and see what it's about. Phone in to any of the phone calls on Wednesday evenings and see what we're about, and do not hesitate to reach out to any of us if you want to get engaged. We try to all be very open and approachable. And I think there are opportunities for anyone to get engaged and have meaningful experiences in leadership, connection, engagement. So please, by all means, reach out to us or join our calls and become a part of our greater family.
Great. And the head of that family is about to be Dr. Alimi as the chair-elect. So I'll leave Dr. Alimi with the last word.
Yes, thanks again. And, to reiterate Dr. Coleman and Dr. Ritter, the RAS family is always open and engaging, and we try very intentionally to be very inclusive, making sure that we give multiple people opportunities within our committees, within different leadership roles. And something else to just reiterate, that joining a call doesn't mean that that's all you have to do. Being able to engage with people that are all over the world and also within the field of surgery lets you meet people that you might never meet at your home campus. And I think that that's a really big pearl that we have within RAS. Some of the people that I get to talk to every day about surgical problems aren't at my own institution, and I met them through this organization. And I think that it's really important sort of expanding the opportunities that we have and not just focusing on what we're doing locally and engaging with others around the world as well as within the United States. And so, we welcome anybody to join RAS. We are super excited to make sure that we put, our money where our mouth is, and making sure that we're egregiously inclusive in what we're doing here at RAS. And we look forward to meeting folks.
Well, thank you so much. Thanks to all three of you for your time and insights, and congratulations to all three of you on your soon to be elections as the officers of the executive of RAS.
Thank you.
Thank you.